Hi, Lena. Tell me
Good
about you.
morning. I'm Lena from Chennai. I completed my BSc Biochemistry from Devani Ammal College, Viluppuram.
Okay. What is hypothalamus?
Hypothalamus is a part of the brain and it will maintain the homeostasis and it regulates the body temperature, heart rate, and blood pressure. And the hormone secreted by the hypothalamus controls the function of the pituitary gland. And hypothalamus governs the emotions such as anger, pleasure, hunger, sex drive, etc.
What is gestation? And explain about trimesters also.
Gestation is nothing but is a pregnancy period. It is a condition of the woman, right? Start from the time conceives until the childbirth, and it usually range about 38 to 42 weeks. It was divided into three trimester, first, second, and third. Each contain 13 weeks approximately in length.
Okay. Can you explain about phases of menstrual cycle?
There are three phases in menstrual cycle. They are follicular phase, ovulatory phase, and luteal phase.
What is onycholysis?
Onycholysis is a condition in which the nail is loosened from the nail bed.
What is parenchyma?
Parenchyma is the inflammation of the skin around the nail or fingernail, usually caused by the bacteria or fungi.
What is lysis?
Lysis is destruction or decomposition of cells.
What is the Roman number of seventh cranial nerve and its functions?
Seventh cranial nerve is facial nerve. It will move the facial muscles and it receives sensory input for ear pain and taste, and it also supplies nerves for the salivary and tear glands.
Can you explain about conductive masses of heart?
Heart, it contains a specialized tissue called conductive tissue. It will generate a rhythmic electric impulses without any external stimulation. There are four masses of conductive tissues are present in the heart. They are sinoatrial node, atrioventricular node, bundle of His, and Purkinje's fibers.
What is TB? Abbreviation.
BP is blood pressure. Blood pressure is systolic pressure.
TB.
Excuse me.
TB.
TB. TB is tuberculosis. It is caused by Mycobacterium tuberculosis and it is an infectious disease characterized by the severe cough, chest pain, and weight loss and spitting of blood.
What is SOB?
SOB is shortness of breath.
GERD, GERD.
GERD, gastroesophageal reflux disease.
Can you explain guidelines for external causes of an injury?
External causes code includes the reason for the injury, place of occurrence, activity, and status code. The reason for the injury, the action is the main term in the alphabetic index, and place of occurrence, where it is placed. Example like courtyard, prison, and activity, what the person is doing, like walking on the side yard means the walking is the main term, and the status code range from Y99 in tabular list. An external cause code should be assigned with all 7 characters.
Can you explain guidelines for HIV?
In HIV, we should only code only the confirmed cases of HIV infection by checking the attestation of physician in the impression column, and you have to check the confirmatory test, Western blot test is performed or not. And if the patient is admitted for HIV related condition, then the primary code should be for an HIV code in the sequencing order. Sequencing order is most important for assigning the code. It should be based on the severity. If the patient with HIV admitted for unrelated condition, then the primary code should be for an unrelated condition followed by HIV code and other conditions being treated. HIV known, HIV positive, HIV test positive. These are the similar terminology for asymptomatic HIV. Asymptomatic HIV code is Z21. So Z series code is a status code. It has no money value and it should be assigned lost in the sequencing order.
What is cholelithiasis?
Cholelithiasis, it is calculi or gallstones in the gallbladder.
What are the regions of small intestine?
The regions of small intestines are duodenum, jejunum, and ileum.
Can you explain about neoplasm and its types?
Neoplasm, any abnormal growth of cells in the body tissues, it is types or benign. It does not spread around the surrounding tissue. Malignant, it will spread around the surrounding tissue. And carcinoma incident is a partially developed malignant.
What is fracture and its major types?
Fracture, it is a breaking of bone or cartilage, and it is generally divided into open fracture and closed fracture. Open fracture, in which the breakage of the bone which perforates onto the skin, whereas in the closed fracture it does not perforate on the skin. And it also divided into traumatic and pathological fracture. Traumatic fracture is due to some accident or assault, whereas pathological fracture is due to some disease condition like osteoporosis.
Can you explain about neuron and its types, parts?
Neuron, it is the nerve cells. It is a functional unit of the nervous system. The parts of the neurons are cell body, dendrites, and axon. The types of neuron based on the functions are sensory neurons, interneuron, and motor neurons. Based on the structure, it was divided into three types: multipolar neurons, bipolar, and unipolar neurons.
What is dysphagia?
Dysphagia is a feeling of difficulty in swallowing.
How many bones in an adult, children, and fetus?
The bones of adult is 206, and bones of children 2 and 3, and bones of fetus 306.
What are connective tissue disease conditions?
Some of the connective tissue conditions are SLE, systemic lupus erythematosus, scleroderma, rheumatoid arthritis, and polymyositis.
Can you explain categories of diabetes mellitus?
There are 5 categories. Or the type 1 is insulin dependent diabetes mellitus. It occurs in children or adolescents below 30 years of age. It is also called juvenile diabetes mellitus. And type 2 is non-insulin dependent diabetes. It occurs above 30 years of age. And occurs above the 30 years of age. And type 3 is diabetes mellitus due to disease or condition. And type 4 is impaired glucose tolerance, where the diabetic is normal or diabetic in stage. And type 5 is gestational diabetes that occurs only during the pregnancy. The first 2 is considered as primary diabetes, and other 3 are considered as secondary diabetes mellitus.
What is encephalitis?
It is an inflammation of the brain.
What is glaucoma?
Glaucoma, it is a damage to the optic nerve which leads to blurred vision and eventually blindness, and it is categorized into open angle and angle closure glaucoma.
Can you explain about pancreas and its functions?
Pancreas is the long narrow gland. It will lie posterior and slight inferior to the stomach, and it has 2 functions. It acts as both endocrine and exocrine. The exocrine function of the pancreas secrete digestive juices and digestive enzymes. The digestive juices helps in lessening the acidity of the chyme entering the duodenum, and the pancreatic and the digestive enzymes helps in the digestion of carbohydrate, fat, and proteins. The endocrine part of the pancreas are called as isolates of Langerhans. It will secrete the 2 hormones, insulin and glucagon, which will maintain and uses the glucose concentration in the blood.
Can you explain about blood pressure, BP?
Blood pressure, it is a systolic pressure followed by the diastolic pressure. The normal value of blood pressure is 120/80 mmHg. 120 denotes the systolic pressure. It is the period of contraction. 80 denotes the diastolic pressure. It is the period of relaxation, and millimeters of mercury mmHg.
Can you explain about functions of heart in detail?
The main function of the heart is to pump the blood throughout the body through the following steps. Superior vena cava carry the deoxygenated blood from the upper portion of the body to the right atrium, and the inferior vena cava carry the deoxygenated blood from the lower portion of the body to the heart right atrium. The right atrium pumps the blood to the right ventricle through tricuspid valve. The right ventricle pumps the blood to the pulmonary trunk through pulmonary semilunar valve. Soon after leaving the heart, it was divided into right pulmonary artery and left pulmonary artery. So this pulmonary artery carry the deoxygenated blood to the lungs. Within the lungs, the air sacs called alveoli are present. It will transport the oxygen to the blood. Thus, the blood become oxygenated in the lungs. These oxygenated bloods are pumped to the left atrium through pulmonary vein. The left atrium pumps the blood to the left ventricle through mitral valve or bicuspid valve. The left ventricle pumps the oxygenated blood to the aorta through aortic semilunar valve. The aorta contains three main branches. They are left subclavian artery, branchiocephalic, and left common carotid artery. And through the arterial system, the oxygenated blood are transported throughout the body tissues. Eventually reaches the capillary beds where the transfer of oxygen and carbon dioxide takes place. So this cycle will continue for every heartbeat.
Okay. Thank you, Lena.
Thank you.